Nice to meet all of you. I'm Mark. Mark, we're Director of Patient Experience at Trillium Health Partners, and this is my colleague Adam.
Hi.
I'll get Adam to introduce himself a little more in a minute, but yeah, really grateful to be here, especially speaking after Christiana. Is Christiana still here? Just to say what a real masterclass, she's at the back, on the importance of patient-centered care and empathy. So Adam and I are here to talk a little bit about a journey that we've been on at Trillium Health Partners to really understand and unpack the importance of building an empathetic healthcare system and really listening to and learning from the people that we serve. So we're going to share some reflections just on that journey overall, but a lot of what we're going to be talking towards the end is where we're trying to go with a lot of this, which really ties in nicely to what Christiana shared. Because we come from an organization that's huge. There's about 15,000 people there, and so we're working, in our circles, but try to move forward in the importance of patient-centered care and the importance of empathy. But we have a real journey to go on to really make that happen within our organization. So, with that, we'll get started. Just see the time here is counting down to 0. Hopefully, it will renew. It's going into the negative now. Okay. Anyway, you're with us for a little while, and hopefully we'll make it a good experience for you. Again, really excited just to share with you some reflections. Obviously, coming to a customer experience session, we really do think about the people we serve differently than just customers. There's certainly an importance of thinking about customer service and that kind of philosophy, but the people that we care for, we know, are in some of their most vulnerable moments in their life, and the people that are in their families and the caregivers that support patients. These are really difficult moments in people's lives, and so we think about the people we serve in slightly different terms than customers, and hopefully you'll get a sense about why that is. So let's move into our slides. So just to kind of situate you, we'll talk a little bit about the organization we work in at Trillium Health Partners in Mississauga. And then we'll talk a little bit about our program within the hospital. We're relatively small in terms of the overall size, but I'll explain just some of the functions that we use to hear from patients and families in different ways. But we really do want to focus on this third bullet quite a bit around, and you've heard, I think, a lot of sessions today are really around how do we modernize as organizations? How do we move, into a new era that the way people interact with the world is in a very different way? So it's a lot about that. We'll talk a bit about some of the response rates that we used to get from our surveys versus today. And going forward, some of the kind of key themes that people are sharing with us about what matters to them. Focusing on some of those real key drivers that won't steal Adam's thunder, but there is some consistency across some of our key drivers, and some of the interesting trends that are showing us the way forward. And then really touching on, as I said, that last part is really where we're going with trying to enhance the emotional support and the empathy and the connection, the human connection in healthcare. So probably many of you know Mississauga. We definitely, are really privileged to serve one of the most diverse communities in not only Canada but also the world. So obviously very close to Toronto, but there's just a tremendous amount of unique folks that live in that area. Not only in terms of the where folks come from originally. I think there's, much of the population is first or second generation Canadian, but there's over 130 languages spoken. And in the last census, there was, showed that we had over 50,000 newcomers to Canada as well. So we know we're serving a very special place, and we're trying to match the healthcare to meet the needs of the community. We're a pretty large institution, and we've close to 1,457 beds, 7 different sites. Our 3 main hospitals are Mississauga Hospital, Credit Valley Hospital, and the Queensway Health Centre. We do have a number of different highly specialized programs, as well as we're a regional center for a number of different healthcare needs. I won't go through them all, but There's a lot going on at our organization, a lot of people that we serve as well, which I'll just touch on briefly. We serve close to 1.72 million people per year, and in doing that care, we also are leading some of the numbers in the province in terms of number of births. I think it's close to the population of Smiths Falls every year is born at Trillium Health Partners. Some people, I think, in this room, in speaking with him, were born with us. Close to 68,000 surgeries a year, almost 70,000 inpatient admissions. And then in the blue there is showing you our number of emergency room visits. We continue to have some of the highest and busiest emergency rooms, not only in Ontario, but in the country. So Trillium Health Partners serves 225,000 patients per year in our ER, and that's combining University Health Network, Sunnybrook, and Sinai, the number of visits. So our emergency room is in high demand with long wait lists, wait times. There is hope on the horizon in terms of, like, we definitely are trying to provide care to a community that we really can't keep pace with the demand. That being said, we are working towards 2 new facilities, which is very exciting, but still several years away. I guess the bottom one is coming first. I think in the next 4 or 5 years is the Queensway Health Center to serve those with complex care needs and rehabilitation services. So that'll be a 9-story facility. Some of those, the care for those populations right now are served in different pockets in smaller institutions that we connect to, but I guess it's really the top one that is going to be very noticeable to the entire Mississauga community. It's going to be 24 stories tall. If you've ever been to Mississauga, the corner of Huron, Ontario and Queensway, the current hospital there I think is about 7 stories. So 24 stories is going to dwarf everything in that area. Just for comparison, Terminal 3 at the Toronto Airport, Pearson Airport, is 1.9 million square feet. So this is going to be a huge facility, not just improving the number of beds, but also making it a little bit more of a private experience. All of the rooms will be private. A huge increase in the number of operating rooms. Our emergency department is planned to triple in size. There'll be a women's and children's hospital integrated into the hospital, and a wellness center as well, which is great. This is great news, but even with these projections of growth, we're still going to be below the demand for our community, if you can believe it. So there's a lot of modernization on our horizon. Certainly physical infrastructure is a big part of it, but we really just wanted to give you that context about where we're working within, because when we talk about the importance of providing care, it's not just the buildings and it's not just the staff. It really is ultimately about the people who we are serving. And so our office within Trillium Health Partners, as I said, is relatively small. We're about 10 people. We do provide a number of different functions, though. We are really going to dive into the patient experience measurement side today, because that's sort of like our broadest look at the people that we serve and what matters to them, and how we're feeding that information back to the front lines to create continuous improvement. But importantly, our office also handles all of the complaints, patient relations. That's where, and we also receive compliments too, but we are really sort of neutral, impartial, a number of staff to really understand what's going on with a patient situation, so that we can really advocate with them and be that buffer with staff to ensure that we connect them back to the care that they need. So a very important function. That's actually legislated. All hospitals must have that, as well as long-term care. And then, as was described a little bit in our previous session, so we call it our Patient Family Partners program. We do have a number of advisory councils within that, but we involve patients and families in many different ways, different working groups, reviewing documents, being involved in different design and delivery of care programs and services, really getting that input before we launch something, so that we're not just guessing, that we really get a better appreciation of what matters to people sort of as we're in the process of developing those. And then also within our office, our language services, as I mentioned, we have a very diverse population that we're serving. If you can't speak in your first language, that's a huge barrier to getting people-centered care. And so we connect people to all sorts of different interpreters. We also use a device called Voice, which is a tablet, connects you in real time to a translator in over 240 languages. So all of these things are very important to really empower people in their journey, making sure that they're fully able to participate and share their experiences so that we can hopefully make improvements. So Adam's going to really jump in now to our patient experience function to talk about really where we've tried to modernize on that front.
Thank you, Mark. Hey, everyone. Adam Chudinsky, lead of patient experience measurement and planning at Trillium Health Partners. Thank you for joining us today. Thank you for coming to this session. I know there's another one, so thank you guys for stopping by. Modernizing patient experience for us, it does seem strange because everybody's used to giving feedback on an app, on a phone with an AI chatbot. But at Trillium for years, up until about 2 years ago, everything was still paper-based or call center-based. Imagine somebody's calling you and they're saying, hey, can I bug you for the next hour because there's a 60-question survey? No one was going to stand the line for that. So one of our big modernizations was going from over 60 questions to down to 18. Another modernization was instead of somebody calling you or getting a mailed-in survey, was now we're distributing through email, QR code, tablets. Some people are giving us feedback the moment they leave our ED, our inpatient units. For our NICU and some of our mental health units, they're doing it on an iPad as they're being discharged. So we're getting as close to real-time feedback as we can get right now. Some of our historical challenges besides the length of time is the cost. We were using a third-party call center, and it cost about $20 per call to reach somebody. So even if you were reaching somebody, it was expensive for the hospital. It wasn't the best use of taxpayer dollars. Now we're able to reach out digitally, getting a lot more information, because we're able to break down the data faster, and we're able to segment it by different backgrounds, different units. We're able to then turn it around to our front lines. And even as I know one of the earlier sessions, the gentleman was talking from the city of Burlington about a future strategic plan. We're now using the patient experience data we are getting and putting it into our next strategy plan and breaking it down so the strategy plan speaks about the voice of the community that Mark mentioned. Just to talk about how much more we're getting now, the high column there in all those purples shows our last fiscal year of responses. And overall, we saw a 600% increase in response rates by moving to digital. And with outpatient adult, which is the upper left one there, it's over 2,500% increase, where we were getting before maybe 500 in a year for a very small amount of areas. Now we're getting close to 14,000. All of those numbers are already 1 year old. We are approaching our next fiscal year, and we have already surpassed our current numbers, yet again, with still about 10 days to go. Data-driven insights. As I mentioned before, real-time insights. You come to our hospital, whether it be an ED, an inpatient visit, your child is there, or an outpatient visit, you will get an email, if you've consented, within 1 to 2 days of being at our hospital. If you didn't consent to email, we have QR codes available on our after-visit summaries that, again, you scan, you choose your unit, you tell us how your whole experience went. We have dynamic dashboards that the moment somebody submits their response, it goes to a dashboard. Managers can review this 24/7. It's constantly updated. It's constantly giving them new information. They're able to see what was said, whether it be positive or negative. They're able to share it with their unit. We have about 250 of our enabling staff members, our managers, our senior leadership who can go into the dashboard and see what anyone is saying. We ask them that they obviously share the positive items at huddle, and maybe some of the performance management, they have the one-on-one discussions. Jump to the next one. Okay, what matters most to patients? It's broken down here by our 3 highest survey types, inpatient, outpatient, and ED. But what matters that's very positive for our rate 0 to 10 experience is people say we treat them with dignity and respect, we give them good communication, we involve them in our decision making. Well, when we look at the data and I break it down by different age groups, or we have a question where we ask people, what's your background and culture? I do it by gender identity, background culture, age groups. It's emotional support for fears, anxieties, and worries, where we are scoring the lowest. So Christiana, who's at the back right now, exact same thing. It's about empathy. It's about connecting with the patient. People are missing those opportunities where they can just spend a little bit more time with patients. And we find this in the data when we look at it, that it's some simple things as saying, hello, Adam, how are you doing today? Learning something about a patient, rather than just walking up and being mean to them right off the bat. Okay? I'll just jump to the next one. The impact that emotional support has on our 0 to 10 scores. The graphs you see here, when somebody gives us a score of they've never received emotional support, their average 0 to 10 score is the lowest bar there. So when it comes to in the emergency department, if you give us I've never received emotional support, you're probably going to score us around the 3.1, which those people who then give us an always are scoring a 9.3. Now, Mark, I, and our team, and all of our hospital employees, as we work to improve this, we're not looking to jump people right from the never to the always. We want to slowly improve it so people in the never category move to the sometimes to the usually to the always. And as you transition people through those different categories by providing them the appropriate support, the overall 0 to 10 score for the hospital will increase. Some other things people have mentioned when they don't receive care, they are not getting proper discharge instructions, they don't get their symptoms addressed, or they don't feel involved in their care. So there is also a relation not only to our 0 to 10 score, but how people feel on their emotional support to other parts of their journey. Now, we have 3 open-ended questions on our survey where we ask people, why did you give us a 0 to 10 score? What are 2 things we did well? And what are 2 things that could be improved? Myself, my colleague Carrie, and a gentleman in the room named Umer there spent a lot of the summer reading line by line, thousands of comments, because we do not yet have AI enabled for this, about when people said they never got care or they always got care. And these were the themes that people were basically saying, regardless if they said they always got care or they never got care. They wanted, explain things clearly to me, make sure I'm okay, treat me like a friend, learn something about me, bring my family in, make my area a little cleaner, allow me to feel safe. And when you were reading some of these, and if you guys speak to Amer later, some of them were really heart-wrenching because some people were saying, you didn't treat me like a human being. You ignored me. I came here for help, I'm never coming back. And the same unit was getting, this was the best experience of my life. What did you guys do that was different? I don't know who changed something, I don't know what happened, but I'm always coming to Trillium. So you get both sides, and if you focus on emotional support, you can find that. Christiana, you did mention some of the challenges. We have a very young workforce now at Trillium because a lot of the older workforce has left. The younger workforce, because they're so task-oriented where they go from A to B to C, they don't take a moment in between to learn anything about the patient, to engage the patient. And we are also telling them, there was a gentleman giving a comment about senior management. Senior management tells the staff, push people through, especially in outpatient clinics. So then we get the pushback, well, what do you want us to do? Do you want us to be efficient, or do you want us to provide empathy? And we are going with the premise that empathy should just be ingrained in your day-to-day. It should not be that you are forced to do it. It should be something simple. There are comments there on the bottom, left and right side, for people who say they never got support versus those who did. The left side, you can see how I mentioned people said they were not treated like a human being. The top 2 actually are both from the emergency department. So on one side, someone's saying, I'm never coming back here. I'm going to some place where I can be treated like a human being. Whereas the direct opposite side in the same ED says, thank you for treating me like a human being. The third one is a mental health example. When I actually sent it to the mental health team, they said, this is why we are in healthcare. Thank you for sharing us with this, Adam, because the patient is saying, I feel like I belong. They didn't misjudge me. They didn't push me away. I feel that I am loved. And this is what we are aiming for at Trillium. Now, when it comes to closing the emotional gap, it can be as simple as a discussion. It can be as simple as how, when somebody approaches you at the registration desk, how you interact with them. It can be as easy as sharing things at the huddle and then implementing tools so that you can actually talk and spend the time so your younger workforce gets better at emotional connections and support. Now, what does this mean for patients? Patients will obviously feel better about their care. They have better outcomes when they feel better, more cared for. What it would mean, for the staff, if we give them the proper tools, some of them might currently feel awkward having these emotional support conversations with patients. If you give them the right tools, they can feel better about it, they can feel a little bit easier, and they can move forward with it. And then for leadership, the rate 0 to 10 score should go up, which will also improve our quality improvement plan and our tracking with the Government of Ontario.
Yeah, so that's our last slide. But just to say, we really wanted to point towards, there's a lot of work ahead. Like we feel like there's been some really good listening and assessing, and we feel like we have a good grasp of what some of the issues are, and seeing some of the trending and the consistency. And it's not revolutionary. I think you saw in that slide about the open text themes, a lot of it is pretty straightforward and basic in a sense. It's just the how to ensure that it's happening, and ensuring that staff are supported in the work that they do. There's a lot of strain on them. There's been a lot of turnover. But just the importance of those little moments in care that can change someone's experience. And that starts well beyond you getting to actually even receiving the care. It's right from the moment you come to our parking lot to the registration. Just a quick anecdote. I remember years ago going to an appointment with my wife. I won't name what city we were living at the time, but we were greeted with, "My name is such and such," and I'm telling you that because I was told I have to. And we're like, whoa, like this person is not having a good day, and it set the whole experience. Even though the care was fine and whatever, that's what we remember from that moment. And so we're trying to encourage staff to appreciate that human connectedness without making them feel like I'm only doing this because I have to do it. It's really just trying to build that awareness and showing that again, we are people caring for people, and that's ultimately what we're about. So we'll take some questions, but thanks again for this opportunity to share our journey and really trying to capture and understand the importance of patients' experience.
Hello again.
Hello.
That's an amazing uptick in the amount of engagement you're getting from various patients on those purple spikes there. Do you have a corresponding surveys that you do for the staff? And if so, how do you connect the results of those surveys with the ones from patients to kind of find insights or correlations between the two?
Yeah, we may both. Yeah, Adam, you start.
Sure. So yes, we run an employee satisfaction survey about every 1 or 2 years. So we just ran our first one on this system that we're using for patient experience surveys in the fall. And we are looking at it, especially with the emotional support question, which units are giving us, our patient experiencing the lowest amount of fears, anxieties, and worries support, and what is the staff experience on those, right? Do staff feel safe? Because there's a question, do you feel emotionally safe at work? What is the score for that area, and what is the score for the patients, and how can we, try to improve things for both sides? Or are they different, right? Are patients saying they feel they get a lot of support, but staff don't feel emotionally safe, right? We have seen that as well. So that is one way we're looking at it.
Yeah, we see a lot of potential for this. To our knowledge, there's not a lot of this happening in Ontario or even Canada that we've seen as some examples. One of our colleagues is at a conference in the US this week, and there are going to be a few examples there shared of how hospitals are connecting the employee experience with the patient experience. And so we do really hope to learn from that, because I think it's a natural connection to make. It's just, how are we acting on it? What are we going to do to try to adjust it and change it? And that goes, again, well beyond just us, but we are trying to make the case for the importance of making those connections. I think there's a question there.
First of all, I think it's amazing that you guys have a dedicated team for this. I didn't even know that this actually existed in your hospital system. So sometimes when people are providing feedback, like I think of when I look at Google reviews, right? When I do, let's say I'm deciding to purchase a product from a company or deal with a certain company, I see negative reviews, but then immediately I see the response from the owners who are very on top of the reviews, and they're explaining the situation, right? So do you have something similar where, let's say somebody, of course, via consent, leaves their contact information, and that allows you to provide feedback directly, addressing their comment, and so that gives you opportunity for sort of a two-way conversation to sort of maybe perhaps provide some context on why they felt or they went through what they did.
For sure. I can touch on that first, and then maybe to Adam.
I'll let you just explain how your team works on it.
Yeah, sure. So we do have a function within our office of patient relations. So we receive outreach through a number of different routes. Sometimes people reach out to us directly. Sometimes they'll go to our CEO office. But sometimes when people submit their satisfaction survey, there's a question there as to, would you like to be contacted? And some folks just say, no, I'm good just to leave you my feedback. But other folks say, no, I'd like to hear what your thoughts are about this. And so our team, I think, receives about 90 of those referrals a month through that route, and we do follow up with them directly to better understand. Again, maybe it's a simple thing, maybe it's more complex, and it should have actually been flagged sooner. So it's another sort of outlet for us to hear that we do follow up with. We are also familiar with some other hospitals in Canada that if you do get like below a certain number on a score, they will proactively reach out to you. So we're talking about what that could look like. I think we did some number crunching, and it would be like significantly adding to our volumes. But that's where it would be good to go. The actual following up on like through Google reviews, that sort of thing, we haven't quite touched on, maybe in part just a little bit of hesitancy around like social media and what gets online and all those sorts of things. So we'd probably need to engage our communications team a little bit more on that side of things. But the following up with people is really important, and we do some of that for sure.
Mark answered it perfectly.
Okay.
So how are you collecting the email addresses, like in an emergency setting?
So when you approach our registration or schedulers, in ED, inpatient, whatever, you are asked, name, email. At that point, there's 3 different types of consent we ask you for. Do you want clinical communication, which is like, do you want your results? Do you want us to email you about appointments? Do you want educational materials? The next one where we fall under is just general hospital communications. So it has to deal with patient experience surveys. Maybe our communications and strategy team is going to let you know about our annual report, or we have a big town hall. And then the third one is, basically solicitation from our foundation about foundation news or asking for money. So you go up to registration, you give your email, and then you consent to all 3 of those, one of those, none of those. It's completely up to you. And then the system pulls me the emails that I can then send the survey to. But since not everybody gives us their email, we have the QR code option. And then, as I mentioned, on mental health and NICU, it's an iPad.
Hi, 2 strangers.
Hey, Sam.
Adam, you mentioned that Trillium is in one of the most diverse communities in the world. Mm. And in terms of data collection, are you tracking trends in relation to the diversity in the community and the responses that they give you?
Yeah, so thank you, Sam, for that question. Yes. As we are now working on our new strategic plan, I've given the data based on the different background and cultures that people have identified with, and we've looked at that compared to our Mississauga census data. It's not perfect. We do have a little bit higher white respondents compared to other areas of our community, but it is actually a lot better with the electronic distribution compared to the paper-based and call center one we had from the year before. We've actually seen more marginalized people responding in this method as opposed to before. So it's getting better. It's not perfect.
Yeah, and I think there's a lot of room for us to figure out how to action some of what we're learning through that, especially in terms of the trust building. We know that's a big barrier for different communities, and so as Adam mentioned, like we're getting some of those early insights to kind of shape our direction forward, but the actual getting out into the community on the ground. There's been a lot more of that I've seen, and I've just been at Trillium 9 months, but there's a lot more interest in doing that even further. And I think we can apply what we're learning and hearing through the survey to really target different groups, to really do that outreach, do again, just basic things like relationship building and awareness and things that are even beyond just your health needs. It's more just about, what are your impressions of our hospital and what could we do to ensure that you feel safe and that you feel like it's the right place to go? Great question.
Yeah, and sort of building off of that point about relationship building. In the future, if I could ask you, in 5 years, in 10 years, how do you think your role will transform? What's a prediction that you would make about relationship building with patients, maybe even before they're patients, in terms of just leveraging technology to make that happen?
Mm-hmm. Great question.
So, one of our book goals when that new building is built, we recently installed new technology at the bedside so patients can watch, their streaming services, Netflix, Disney, whatever it may be, But we also want to put the survey on that because, again, not everybody has a device at home, not everybody has a cell phone. So we do want to get people as they're being discharged to use that screen to give us a survey. That would, again, get us really real-time feedback. So while they're in the hospital, that would be my strategy. Maybe Mark wants to speak for the outside.
Yeah, outside the hospital, for sure. I think there's a lot of work to do. And you know, we definitely connect and collaborate with a lot of our different health system partners. But I think so many people, they don't really identify as a patient until they're really in that setting. And, you know, I'd love to try to build some more upstream awareness that we're all going to interact with the healthcare system in a lot more ways than, I mean, there's a lot of interaction with the education system, less with the justice system, but with healthcare, for sure, at some point, we're all going to touch it. And it's really trying to empower people that when you do need it, you should be active, you should be involved. You shouldn't just sit back and assume things are all working and connecting, and that you also possess a lot of insight that can help inform us as we design care. There's a lot of change that goes on within healthcare all the time. We're constantly redesigning and reinventing. The pandemic flipped so many different processes upside down, and we're continuing to adapt and evolve. But I would love for people to come into our care knowing that it's really important to be active and involved and share your feedback. We have some work to do, I think, just to even tell the story as to why we're collecting information, what we're doing with it, how it's transforming and you know, making changes, because that, I think, will give people a lot more confidence of, like, you're not just doing this to check a box, or you're not just saying that, you know, what I have to say matters. You're actually doing something about it, and that's the ultimate test. So I do think there's a lot of work to just build more of that public awareness and outreach, so that when you do need our services, you're feeling confident right from the get-go.
So maybe just to wrap it up there, just a couple of thoughts. One of the things that we're seeing is less and less use of surveys. So actually finding different ways of offering patients, customers, clients, whatever, the opportunity to provide feedback. So we see a lot of organizations that are now moving to video feedback. So just send me a clip. Just tell me your thoughts. So moving away from those standard questions, which we all know has got a bunch of bias associated with them, and actually asking for genuine feedback around it. What they're finding when they do that is that they're uncovering the real emotional needs that are there. Because it's very hard in a score to convey my emotional need. Mm-hmm. I mean, is 6, well, am I confident around that? Do I feel a lot of trust in that? I mean, I don't convey the emotions. And what you've shared is just the power of actually addressing those emotional needs throughout the experience around it. So thank you, Mark and Adam. Really appreciate your time this afternoon.
Thank you.